patients with heart failure, they have multiple problems and they're taken care of by multiple cardiologists. Our electrophysiology group, because they have arrhythmias, and our structural heart team with the valve issues, and it's just so powerful to be in a place where you can take care of all that with people inventing new ways to manage those things.
I absolutely love being able to pick up the phone and speak to the expert.
Right.
Right? Doesn't matter. I can always find someone that has an expertise in that specific area.
Yeah.
It's fantastic.
Yeah, you don't even have to pick up the phone. You just
Yeah,
walk down the hallway.
I knock on their door.
Yep.
The other thing I very often tell people, the one thing I think you really have to focus on, especially in what we do, is making sure you maintain that therapeutic relationship with your patients. Especially with the patients we care for, it's a lifelong relationship. And that trust, once it's built, if that breaks, it's really difficult to get that back. And so maintaining that therapeutic relationship and that trust is so important for us to be able to provide the care that we need, especially when it's a life and death situation that we're really talking about.
Yeah, and the other part of that is it's okay to be vulnerable. You don't have to know the answer. Our patients ask us for what the answer is. Often we don't know the answer, but we search for it. And the same for our students. I think they're in a situation where they're used to getting test questions correct. That's how they got to where they were. But in medicine, the answer's not always there. So don't jump to the first answer. Keep exploring. As you and I know, some of our best doctors are the ones, and best students are the ones who know when they don't know, and then look for that answer.
Do you remember the first time we worked together?
Well, I think you were a resident at the time. Back then you were calling me Dr. Smith, and to this day I have to correct you when you call me Dr. Smith.
I've gotten better.
Right.
I was a third-year resident, and I think it was a weekend, and I was trying to do a central line in the ICU. The ICUs were open at that point. And I must have locked my knees or something, and I think do you remember this? I almost passed out. So you had to put me on the floor.
Don't remember.
You don't remember?
No.
I won't forget it. Because then you had to ask me, like, Divya, are you pregnant? I was like, no.
I think she's talking about someone else.
I won't forget that. That was the first time we worked together. Then I was a cardiology fellow. So I was actually going to be a interventional cardiologist is what my goal was. But then I did my heart failure rotation. And I found my passion, to be quite honest. Working with you and Raja, who were the only two heart failure doctors at that time, if you remember, I could take care of very sick people and give them an opportunity, give them a chance at life. So it was wonderful. So thank you for leading me down the road that has gotten me to my passion.
Well, thanks. I think the great thing from my perspective is that we have people who train under us, and then they become our colleagues, and then they become the expert that we go to. And so we're constantly asking each other questions and saying, hey, can you help me with this on this patient? And that's fun, and that helps keep us young as well.